Clinical Fellowship Interview Questions: How to Prepare for an SLP Job Interview. With over 300 master's degree programs in speech-language pathology in the U.S. alone, it is no surprise that finding and landing a job can be competitive, to say the least. Many SLPs have so many questions about how to prepare for an interview for a medical SLP role and for clinical fellowships. So today, we're going to be talking about exactly that. We'll be discussing how to prepare for a medical SLP job interview, whether you're a seasoned clinician, an SLP transitioning to the medical setting, or a new grad getting ready to land your clinical fellowship. And I do want to start by saying that despite how competitive our field can sometimes feel, SLPs are still very much in demand. In fact, the U.S. Bureau of Labor Statistics projected that speech pathologist jobs would grow 29% from 2020 to 2030. Much faster than the average for all occupations. And make sure you stick around until the end of this video, where I'll give you my top 3 Swallow Your Pride podcast episodes to listen to when you're preparing for an interview. Let's dive in. I'm Theresa Richard. I've been a medical speech pathologist for 15 years. I'm a board-certified specialist in swallowing and swallowing disorders. I'm the founder and CEO of the MedSLP Collective and MedSLP Education. The basics. Let's cover some quick tips and suggestions for what to do before the interview. Do your research. Look at their website, read what they have to say about the SLP department, find out if the facility serves any special populations or has specialized units like a burn unit or cardiac ICU. If necessary, take some time to study up or refresh your memory on topics you may not feel the strongest in, but they could potentially ask about. For example, a colleague of mine prepared for an interview at a large trauma hospital with an excellent neuro rehab department. She spent time refreshing her memory on dysarthria types and therapy techniques for each dysarthria, as well as all of the aphasias. Sure enough, they asked specific questions about the types of dysarthrias and aphasias, and she was prepared. Remember, you are also interviewing them, so prepare your own questions to ask the interviewer at the end. For example, what would success look like in this role? How is it measured? What does a typical day look like in this role? What is the caseload mix like? What opportunities are there for learning, continuing education, and leadership? Go into your interview knowing your wants, negotiables, and your non-negotiables, even if they don't come up in the interview. They will come up when you get an offer afterward. What salary do you need? What salary would you be over the moon happy about? What hours can you work? What hours are a deal breaker for you? For example, if you need to be able to be home to get your kids off the bus at 3, then you can't work for the company if they're requiring you to be there until 5. What are the productivity requirements? That can make or break a job. Make sure to ask about those too. What are you willing to accept or not accept? This is more for when you actually get an offer, but what else is a non-negotiable for you? Access to instrumentals? Hopefully that's a yes. A stipend for continuing education, a certain amount of PTO, flexing your schedule to 4 days a week, extra pay for taking a student. You have the power in the hiring process too. I interviewed for a travel job that sounded great. It was a beautiful location on an island. It was great pay. Then at the end of my interview, I learned their tiny hospital doesn't have a fluoro suite or access to fees. Their SLPs just use their clinical judgment at the bedside. That's a non-negotiable for me. It made it easy to turn that job down, despite all the other perks. Now that we've covered some interview basics, we'll dive into the part of the interview that is most unique to SLPs, the clinical questions. By the way, if you found this video helpful in preparing you for your upcoming interviews, I'd love if you could hit the subscribe button, like, and share this video with any colleagues you know who are going through the process too. Interviewing can be really stressful. I'd love it if we could all get this video out to help more SLPs nail their interviews and land their dream jobs. Standard interview questions. Many MedSLP interviews will contain a mix of clinical and behavioral questions. Have the following prepared. Tell me about yourself, or walk me through your resume. Describe your clinical experience. Be able to talk about your current skills, the frequency with which you did them during your clinical rotations if you're a new grad, and throughout your career if you've been working for a while. For example, how often do you do video fluoroscopy, clinical swallow exams, cognitive communication evals, etc.? What special interests do you have? What are your strengths and weaknesses? Have 5 to 7 specific examples of significant accomplishments. You can have these as a new grad or seasoned SLP. These help the interviewer predict your future behavior based on your past. You might be asked things like, tell me about a time when. For SLPs, the interviewer might ask about times when you had a difficult conversation with a patient or family, handled a difficult situation with a patient, family, the physician, colleagues, time you balanced multiple responsibilities, you had successful outcomes with a patient, took on a leadership role, showed excellent patient care, made a mistake and what you did to fix it, took initiative or did something innovative. Write those questions down and think of an example for each. One of my most favorite questions to ask is about someone's weaknesses. The way they answer this question tells a lot about their self-awareness, emotional intelligence, and problem-solving skills. Everyone has weaknesses, but your awareness of them and how you work around them or through them can tell a lot more about your character than any sort of clinical skill. Having a growth mindset is something that's incredibly valuable to me, and the way this question is answered will usually reveal if you're willing to work through tough challenges or if certain challenges will be too difficult for you to overcome. Clinical interview questions. Clinical interview questions offer a lot of insight into the skill and practice patterns of a clinician. Be prepared to talk about how you do a clinical swallow exam. Talk about exactly what you're looking for in the medical record review, what you do at the bedside, an explanation of your decision-making process regarding instrumentation and diet recommendations, how you approach video fluoroscopy, fees, and/or laryngoscopy, and maybe even prepare to interpret some images if you're interviewing for acute care, voice, and ENT clinic, or mobile fees or modifieds. Any special skills you might have, trach vent experience, laryngectomy, TEP, and how you approach these patients. Areas of neurologic injury and what you may expect, for example, a right CVA versus a left CVA versus brainstem versus anoxic brain injury. Assessments you might use for cognitive communication, aphasia, motor speech disorders. Treatments for each of these areas. When you might refer to a specialist such as GI, ENT, or neuro. How do you keep up with the changing practice patterns? What if you don't know the answer? Share what you do know. Let the interviewer know that you're willing to learn and how you would find the information out. Breathe and remember it's not the end of the world. You're a human who is learning. Your interviewer knows that, and it's better to understand your limitations as a clinician versus fake it till you make it, which maybe can be dangerous to patients. I've interviewed a lot of people over the years, both for my mobile fees businesses as well as the MedSLP Collective. From a clinical perspective, whenever I interviewed an SLP, I didn't just look at their experience. Of course, I started with clinical questions, a few case studies, wanted to hear how they would problem solve through different scenarios. But I also looked at their soft skills, how approachable they were, whether or not they were eager to keep learning and could learn from their mistakes. Because we all make mistakes, but the real mistake is not learning from them. These were sometimes more important to find in clinicians than the clinical experience itself, because I've learned that it's easier to teach clinical skills than it is to teach personal skills. I've experienced this on the other side of the table as well. When I interviewed for jobs, especially my first medical SLP job after working in a school setting, my drive to do as much independent learning and clinical observing as possible gave me the boost I needed to get hired. I was open about the fact that I knew I had a lot to learn, and I also realized that I didn't know what I didn't know but was dedicated to learning. This opened up more doors for me than I expected as a new SLP, and it was a valuable lesson I carried with me throughout my professional development. If you'd like to listen in on discussions dedicated to this very topic for SLPs, you're in luck. I have 3 episodes of the Swallow Your Pride podcast full of interview prep tips and experiences. Check out episodes 105, 205, and 236 of the Swallow Your Pride podcast to learn more, especially if you're preparing for a medical SLP position. If you'd like even more support and resources to help you show up even more prepared at future medical SLP job interviews, I invite you to check out the MedSLP Collective. Go to www.medslpcollective.com and check out our membership options. We offer monthly webinars, weekly resources, and daily community support to help you with your biggest questions, from tough clinical cases to job interview tips and prep questions.